I'd like to call to order the Farmington Board of Education special meeting for Wednesday, January 28th, 2026 at 7:02. Can we all rise for the Pledge of Allegiance?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Use a loud voice. So next item on the agenda, item 3, inviting and receiving public comment or communications. Do we have the sign-in sheet? Okay.
No one signed up.
Do we have public comment tonight? I have going once, going twice. All right, we'll close public comment. Next item on the agenda, item 4, approval of minutes. Item A, approval of the minutes for the January 12th, 2026 Board of Ed regular meeting. Can I have a motion?
I move to approve the January 12th, 2026 Board of Education regular meeting minutes as presented.
Second.
Any discussion? Okay, all those in favor?
Aye.
Aye.
Abstentions?
Oh, that's all.
Yeah, Matt is joining us remotely, so he will be right now. All right, motion passes. Next item on the agenda, item 5, consideration of superintendent's report. Item A, preliminary special services budget 2026-2027.
All right, well, good evening, everyone. Tonight on our agenda, we have 2 preliminary budget presentations that will help set the stage for our work together on Saturday. As you'll see referenced in the opening letter of your budget binders, the proposals to the special services budget are one of our major drivers for our work together this coming year. Our Director of Student Services, Special Services, Wendy Shepard-Banish, is here to share these proposals with you. In addition to the preliminary budget, Wendy's presentation will provide a nice overview of our district's programming and services. Wendy?
Thank you, Superintendent Zanini, Madam Board Chair, our distinguished board members, our viewing audience. So pleased to be able to be here and actually give the presentation finally with all of this weather. I'd be remiss to not thank my supervisor of special services, Melina Rodriguez. We did intend to present together, but we had to divide and conquer to be able to facilitate 2 meetings at once this evening. But she was a strong part of being able to pull this presentation together and provide the information we're delivering tonight. So what I will attempt to do this evening without her is to really bring together to you all the information and the data that will align this plan to really put together a plan that is sustainable for the changing needs of our children and our families in the district, as well as our staff. So I'm going to walk through just the mission and the goals of the department. I always like to compare ourselves to others and the other statewide and data trends that you see across the state of Connecticut for children with special needs. And then we'll compare that to our overall comprehensive programming and making some of the budget recommendations that we need to make this evening. And we're also going to be talking about some of the legislative updates that happened during the course of this year that also support these proposals moving forward. I always start a budget presentation, and how I practice special education is my grandmother has always been my guiding light. And I always start every presentation because one of the theories of my practice, and it stands true with many things, is an ounce of prevention is worth a pound of cure. And for special education services, and when we talk about delivering services for children, early intervention services and being proactive is always a better response and system design over being reactive in nature. So you'll see a lot of that through the course of the development this evening. Our special services mission in the department is not different than any other department within the district. Our core mission is aligned to the global citizen, and we want post-secondary outcomes for our students with exceptionalities, with the same rigor and expectation to live thriving and meaningful lives in their contributions to the community that we do for any children. So the buckets that you have that up there that we divide our department work into are the same that our building principals use to develop their school development plans. So you'll see representation within the recommendations that we make this evening that will support culture and climate, academic achievement, making sure that our students are accessing the curriculum and getting rigorous curriculum, but then also teaching and learning. And specifically for our department, it means writing quality IEPs that actually allow children to access. And that all comes with comprehensive programming, professional development, technical assistance, and our goal this year is to really put in place a system of general supervision to be able to support our staff and our teachers with the assistance that they need to develop those plans and that programming. Across the state of Connecticut, there's lots of discussion about the rising prevalence rate for children that have exceptionalities and need special education services. The story in Farmington has been a little different. So I've been here since July of 2024 and gathering the information and data. We're really going to unpack this evening. So even though the state, we've seen, rises from 15% to 17.8, 17.9, it looks as though here in Farmington, we've been flat with, prevalence rates that hover around 12, 13%. But what we're going to talk about tonight, and I think some of the recommendations that we're making and some of the strains that we hear from the district, actually looking closer at our population of students and their changing needs. Although enrollment stays consistent, their needs are very drastically changing, and it's causing us to make recommendations that better support them. And then you can see down at the bottom, it just gives some estimates there. 2025, we were about 528 this year. There is a rise, we're at 556 students with special needs. Across the state of Connecticut, everybody has concerns about the rising costs of special education. So that chart just kind of captures where we've been from 2013 and that drastic increase. The buckets that are concerning for being able to support these costs are really the same in every district. Consultants to be able to support needs for students, students that require out-of-district placements is a rising concern. And then, of course, the requirement for specialized transportation, often associated with those out-of-district placements. Because it is a trend across the state of Connecticut, the state of Connecticut did some work this year, and they did put together a special education funding increase of about $70 million, and we'll talk about that in a minute. And that's being put forward in grants to districts to be able to support their programming. And we'll talk about that with some of the new changes in legislation. So with the legislative updates, because of those concerns of the rising cost of education and control over it, there's about 3 buckets of legislation that made a lot of changes. I've been practicing special education for about 30 years. This was probably one of the most active years legislatively for special education. Really, I parsed out the recommendations that they made in the legislation in 3 different buckets. One of the recommendations that was made, and originally when the legislation came out, the mandate was school districts will be required to, in the 26-27 school year, ensure that there is instructional coaches in every building who will need to spend 50% of their time being able to attend PPTs, support building staff with technical assistance and supervision, support our building principals, and be able to monitor that. They pulled back a little bit on that language, and rather than making it a mandate, it's now out there as a recommendation, but that is in consideration with some of the concerns that we saw earlier. That $70 million that's being spread out across the state of Connecticut is captured in the Special Education Expansion and Development Grant, the SEED grant. The grant was developed to help create and expand districts, either build or expand on their in-district programming to be able to keep children in district and support their service needs. Different distributions of that money were sent. Some districts got more than others. We have around $30,000, and those funds will be spent to support curriculum needs for our specialized programs, which I will go into in a few minutes. And then, of course, the last bucket of out-of-district education is all around cost control and then monitoring and supervision for any student that is out of district. So it's not developed yet, but in the coming months and into next year, the state will be looking more closely at tuition and billing and making sure that they are putting in place a systematic and aligned system of billing to ensure that there's some cost control for when there are out-of-district placements, and to make sure they're leveling the playing field for districts. But the other piece of that legislation with that is districts they've always been required, but now it's even kind of doubled down in the mandate that we are making sure before we move to placing a student in an out-of-district placement, we are exhausting all our options in district. There are some, it's always been in the law, but they double down, making sure they've done like a functional behavior assessment, that you've tried all your in-district programming, and you've really tried to support the student in district to the greatest extent possible. Continued on with those legislative updates. The other piece was, and again, on those out-of-district placements, really making sure that when students are in an out-of-district placement, that the districts are taking responsibility to closely monitor and support those students. So those requirements on districts, we always scheduled the PPTs and attended the PPTs. That's part of our regular work, but now there is recommendations that the districts have to be regularly doing site visits, ensuring that the schools are implementing the services and the delivery of services properly, verifying that the student is attending school, conducting those site visits. Currently, that load is underneath my case management responsibilities, and so it's figuring out how to continue to support that with these new requirements and recommendations that are put out by the legislative updates. Specialized programs within district follow evidence-based strategies. So in the district, we have the continuum of services for students who have exceptionalities. Some students have very mild needs, and they can access the regular curriculum within the regular education classroom. We program that to the greatest extent possible for all students. However, there are some students that need more highly specialized programs, and they're not able to access the regular education curriculum. So in those highly specialized programs, there are tenets of evidence-based practices that you will regularly find and that we do have here in the district. So you'll typically find that there are lower to teacher student ratios. They need extra supports and more specialized curriculum, that things that look like visual schedules or special equipment to adapt sensory spaces, assistive technology to help with communication. They usually have a higher ratio of para educators to be able to support those children because they have more special needs. And then, of course, all of the instruction is more specialized. So you will have more of the related service providers attached to those people, those students, because they will require speech and language and OT and PT. And then with those programs, we are always expanding and supplementing and reaching out to community partners. With the specialized programs that I'll describe in a few minutes for the district, originally when the district we partnered with CCS, the Center of Children with Special Needs, CCSN, to develop our programmings, and they continue to be a partner in district. Last year, we partnered with Connecticut Behavioral Health, and we sponsored a school-based mental health clinic here at the high school to support our students who actually needed access to clinical-based needs. That's gone really well, so well that we had some outcry from our middle school parents to say, hey, can we roll that support down into the district? That is a partnership of no cost to us, but it provides a supplemental resource that's able to support our children with social and emotional needs. And we also partner with Connecticut Behavioral Health in the area of if we need paraeducators that need extensive amount of training or to be able to support students with behavioral needs, they're able to provide those supports and services. Our comprehensive programming in the district covers our students from pre-K through 22. What that means is our children will come in and they might be identified, we'll talk about it a little bit more, from the state agency, which is the Birth to 3 agency, before they are even school ready. And then we will have to provide them IEP and services for when they are of preschool age. And some students require comprehensive programming that continues on through the age of 22. Until they're able to graduate into an adult agency that will then support them from there. We have all of that continuum of services in district. For our specialized programs, there are 2 kind of buckets that they fall in. Our specialized learning centers, or our SLC programs, support our students with more comprehensive needs. Those would be the students that you would see probably needing the programs through 22. And they usually have intellectual disabilities, autism, multiple disabilities, and they need that specialized programming. And then we also have specialized programs across the district to support our students with social and emotional learning needs from kindergarten up through 12th grade. So again, those services require intensive amounts of related services from occupational therapists, our BCBAs, speech and language. They all get provided with comprehensive programming for transition services. And again, we are always looking for connections with those community partners. So our SAL programs in the district, we have the SEED program at Noah Wallace that gives you the current enrollment numbers there. At that age, it's developmentally appropriate to support them with play-based learning, inclusive peer interactions that their teachers and paraprofessionals support. In the middle school, grades 5 through 8, we have social and emotional learning programs, our SEL programs. The enrollments are up there, and you can see we have the STEPS, the sales program, up at the high school levels. And then for our students that need those transition services through the age of 22, we do have our own cooperative partnership with Simsbury for our Farmington Valley Transition Academy. And that's some of that legislative language that the SEED grant was supposed to support for districts that don't have the advantage of already having co-op programs like that. Those are the enrollment trends for all of those specialized learning centers, the SLCs that we just discussed. And as you can see, there's some ebb and flow, but overall, we've got gradual increasing enrollment within those programs. And then this is the context that I really wanted to dig into a little deeper. So if you think back to that original slide where we saw the prevalence rate increasing across the state, but Farmington being rather flat around that 13%. Although that hasn't changed, the dynamic and the need of the students within this demographic circle has changed. In my practice as an educator, I can tell you 30 years ago, the majority of that circle would just be captured with learning disabilities. And then those supports could happen basically by a special education teacher, some push-in supports in the classroom, and the needs looked very, very different. Now you can see the composition of that circle with an increasing rise in autism and pieces like speech and language. 68% of that circle now requires more intensive supports across the continuum of supports for special services. So there are more children now that require those related services. They require more of that highly specialized programming, and that highly specialized program requires a lot more supervision and intense support to make sure that our staff has the support that they need, and our parents have the support, and our children have the support that they need to be able to continue to develop that programming comprehensively. Birth to 3 is a special group, and they are the area of the highest impact and change on the prevalence rate. For the birth to 3 system is the state system that captures when a child might not be making their developmentally milestones. So we already, when you have the baby comes out and the doctor right away gives that APGAR score and tests if they're, moving all their fingers and they're laughing, or they have a cough. My son had a laugh. They're coughing right away, right? The doctors can catch early on, and then as they go through their typical pediatric appointments, sometimes we will find that children have needs that are identified early on. Now within special education, what we're finding is that children are coming to us more and more with already diagnosed disabilities. Used to be that maybe there were some developmental delays and we would see how they would do for a while, put in some early intervention services, and many times they might even be exited from special education and they'd be moving along their way. It looks a little bit different now. Children are coming now more with already determined diagnoses that we are then responsible and obligated to provide an IEP at the age of 3. And then, you know better, you do better. Our science advances, we know more. Many of our children too are also coming in with medically complex needs, where in years past, they might not have been able to thrive, but now with the miracle of science, families are able to live to full-term deliveries, and our children come in and they have needs that we're required to support. So you can see those birth to 3, that is the biggest indication of our prevalence rate, but that is also setting the stage for the context of what we will need to support moving forward. Typically those children, because their needs are so intense, they will also be the children that are going to continue to need supports and services through the age of 22. So it's our due diligence to get prepared and make the most sustainable plan that we can to be able to support those growing needs. As a special education administrator, and I was able to have the privilege of sharing with some of our new board members all of the responsibilities that fall under the umbrella of the administrative work for the department. So that just gives kind of a glimpse. So not only do we support our students with special needs, but we also support our students that are covered under the American with Disabilities Act and may have 504 plans. The work of the department also encompasses support for Title IX, support for McKinney-Vento, which would be our families experiencing homelessness. There's a whole breadth of supervision that is also the work of the department. And so really, the story of special education numbers is not alone. We're supporting minimally a work of at least 25% of the population in the district. And that would be the workload for special education administrators. So right now it's myself and our supervisor, Melina Rodriguez.
And Wendy, your numbers there don't account for all the times you're involved in pre-work leading up to potential PPTs, students who are receiving intervention services, when you're consulting on plans with schools, high needs cases where students have yet to be identified.
Appreciate that input, and that's why I said the low bar there for the support is 25% of the population.
We know how often we pull you into those conversations.
We do. Once upon a time, and I'm dating myself with this, but in chapter 164, section 10, 7G law, right, there used to be a metric that actually, in order for districts to get funding, there was a prescribed metric for what the supervision should look like for a special education administrator. That language was removed from the law long, long ago, but it's still out there for as guidance that the state will use if districts have question about, like, well, what should we look like with special education administrator? It was removed from the law because they wanted the districts to have more local control and make decisions about that. But the old metric, just to have something to compare this to used to state that for every one special education administrator, that one special education administrator should have a caseload of 23 to 44 personnel. For every two special education administrators, it would be 45 to 74 staff or personnel to supervise, and then add one more for every additional 33 on top of that. If we compare that metric to what we currently have in place, so Melina made a nice graphic to kind of just chunk it on 50, right? Right now, presently, we are 2 administrators that are covering a staff of 250. So just for comparison for the metric. So with that, our first recommendation is, in order to create a sustainable plan that better supports the district, we're looking at the resources that we already have in place and looking to expand and supplement on them. So if you'll go back to that legislation about the instructional coaches, we already have in place within the district a department leader at the high school and 3 care team members. Our care team members are there for precisely those reasons that the instructional coach legislation support at PPTs, supervision, and technical assistance to staff. They oversee our specialized programs and support our staff within our specialized programs. In order for us to meet the level that the legislation is recommending, we would need to add 1 care team member to be able to spread enough of the supervision responsibilities to be able to cover all of the schools. And then this is also support to our building administrators who are consumed much of the time with many of these PPTs. It would add a layer of support and service to them so they can return to being the instructional leaders of our building too. And then for the top level, what we are proposing this year is the introduction of an additional supervisor to be able to split the district and be able to have coverage for an elementary supervisor of special services and then a secondary supervisor of special services, and then allowing me to be more proactive with my supports and development with programming in a better support and being more responsive to families, to students, and to our buildings. So that's recommendation number 1. The other recommendations come and they really relate to those students with those more specialized needs that require more intensive delivery around the support they need for their related services. And what is good about the plan is that we've been able to offset these areas and use the resources that are already existing in place with some shifting of staff, but then also shifting of some of our financial resources that make more financial sense for sustainability for the district. So we're proposing an additional occupational therapist for the district that would be offset by reduction in a consultation line. Right now, we're using outside supports to support, but when you have so many needs, it just makes sense as a district to build your own team. The OT would be supported by what's called a certified occupational assistant. So that would also be offset by a consultation line. We're making a recommendation for a 0.4 increase in the area of speech and language to add support and services there, also offset by the consultation line. As I said, those children coming in have more intense medical needs, requiring more and more of our nurses' support. We're making a recommendation for 0.5 nurse addition to the district, which we feel can be offset by a reduction in a nurse clerk position. The supports and services that we need around school testing and the work of school psychologists is very strained right now. So we're asking for an additional 0.5 position for a school psychologist to support Farmington High School specifically. That can be offset in through natural attrition, just with the ever-changing situation with our para-educators. So we're suggesting a reduction in 2.0 para-educators, and then the additional care team member that we just discussed, as well as the administrator. So overall, the additional administrator, one of the ways that we have learned to bring in more funding in the district is, while the needs of the students are increasing, what has also happened is, because those needs are increasing and it's costing us more to be able to support them, children who typically would not have been able to be eligible to be applied to the excess cost grant we can now apply to the excess cost grant for our in-district students, because we have such comprehensive programming to be able to support them. And so we are collecting more revenue back from the excess cost grant that would be able to offset the supervisor of special education. So with that, we believe that this is a sustainable plan that supports our ever-changing and evolving needs for our students and puts us in a better position to be able to be more responsive to our students, our families, and our staff, and put us in a much more sustainable position that's supporting these ever-changing needs around special education. Thank you. And if I have questions, I can certainly answer them now, or if you need to absorb the information, I'm certainly happy to be with you on Saturday as well.
Well, thank you, Wendy. That was wonderful, very comprehensive, and it's always great to have an overview of all the programs that we do offer in special education. I always feel like I learn something new every time I hear your presentation.
Thank you.
So I'd like to open it up to the board with questions.
I have a few questions. So I only have the page numbers down. I know you don't have numbers on your slide, so I'm going off our agenda pages. On page 15, you have a chart where it shows the percentage of students in Farmington in special education versus the state. And I think it quotes up, it's like 13% or in the teens. But then there's another slide on page 24 where it says there's 25% of our students, our total population are. Can you explain,
Yeah.
am I reading something wrong there? Or
No, you're not, and if it's okay, I can go right back because I think it's easier to show it. So you'll see across the bottom,
Yep.
right? So you'll capture the students with IEPs is at 554.
Yep.
The information I was trying to capture for you there is that alone is not what we are responsible for as administrators. There's also a whole nother group of students that have service plans, and that's underneath 504, right? So when you combine the numbers of 504 students and special education students, it's really closer to 25% of the population that we are constantly doing support, consultation for, and then those little bars where you see referral, consent, and then eligibility, that talks about what the superintendent was just talking about is like, we're involved in the process of supporting buildings, families, and students, even before they end up with a plan many of the time. So 25% is just your solid paper number, but our work is actually much more expansive than that.
So when you're saying if they have a 504, so your work that you just went through is really only covering the IEP section, that bar? Like the 504, who covers, what, is that all covered in everything your team does as well, the 504?
So overall, the responsibilities under my supervision to make sure the district is in good harbor with the law and doing everything they should is both of those things.
Okay.
504 plans though, because they are a regular education plan, rather than the special services team being part of that, usually that's covered by regular education.
You could be
So-
brought into it.
And
but-
I am brought into it, and I do have to advise.
Understood.
So as well as Melina. So usually it is our school counselors that function as our case managers for our 504s. Obviously, there is responsibilities for the regular education teacher. Our elementary building administrators do cover those meetings, and they function as case managers right now. One of the shifts in the proposals that we're making is removing that work from them and then dividing it out among those care team members, which releases them back to being more present within the classrooms and able to function on those meetings. But overall, the district looks to the department administration to be able to have the coaching and the guidance that they need to support all of that population.
Okay, that makes sense. And that actually just goes into my next question, which is the care team slide that you had up there. So I just want to make sure I'm understanding this correctly, or maybe it might be helpful for me, I don't know anyone else, like, this is the proposed, do you have what the current state looks like? So is this all
Yes,
new? Or
yes,
do you
not
have-
all new.
Okay,
Currently, right now, there's myself, the director,
the top
and then
Yes.
one elementary supervisor.
Melina Rodriguez.
is the elementary, and then is this whole
Right.
rectangle on the bottom, does that exist already?
Mostly.
4 out of the 5 exist.
Okay.
Okay.
So the department leader exists, care team member 1 exists, care team member 2 exists, care team member 3 exists. And then that 4th one is the one we're looking to recommend to add for
One.
26-27.
So you're asking for care team member 4, and you're asking for secondary supervisor of
Correct.
special services. So this is 2 positions.
Correct.
Yes.
Okay,
One would be an administrative position, one would be like a certified teaching position.
okay. Got it. And then, I don't know if we'll cover this on Saturday, but you mentioned the seed grant, so the state, the $70 million. How are we able to how do we get some of that? Like, are we?
Oh, we
gonna get
will,
any of it?
don't worry.
Yeah.
It's,
Like, how
it's
much do you anticipate us getting? Like, do we already have an idea of how much Farmington's gonna get?
Yep.
Okay.
Yep, it's little over $30,000,
That's
right?
it. Out of 70 million.
I'm sorry,
Well,
yes.
I mean, you guys, yeah.
How hard is it?
Yes, really the intention of the grant was to help support those districts who didn't have any specialized programming like we already do have. And then like the co-op, like we have the Farmington Valley Transition Academy. It's to support those districts that don't have that and encourage districts to operate in that way. We can dig a little deeper, and I'm not gonna promise that I ever understand the algorithms that the state uses to dispense money. But that is, we've already been told what our allotment is. Where I know I need supports and services is because our students in our specialized learning centers require such unique curriculum, right? Like, putting the money and supports into adapting and really getting them quality curriculum that they need is the best way that we can support what we already have existing in the programs already. So that's where that money is being allocated. And then we access that the same way we access any of our other grants.
Okay, perfect. Thanks for the clarification.
And you'll see in our proposal, you'll see what look like additions of OT as an example. But as Wendy mentioned, we're gonna offset that with reducing costs, hiring outside consultants to come in and do that work, outside contractors. So that's where you'll see like an overall addition, in addition to the supervisor and the care team member, but from the cost perspective for our district, that's where the offset comes in.
Got it. Okay, thank you.
Erica?
Yeah, and actually, so let me just pick up on what you just said, for clarification. The offset is that we're bringing a lot of some of those consulting dollars back into
Correct.
in-house and building that.
Correct, and building our own
Own
staff to build that
staff,
capacity rather than relying on an outside agency.
And that, is from my understanding of the legislation that passed through the special education, is really to align with what they're encouraging districts to do that qualify for that percentage, is to bring in-house that sort of, that specialized learning curriculum that is more, higher, sort of has a higher level of need for the student.
Right.
So that aligns with that ability to be able to apply for those funds to be
Right,
brought in for
right.
the excess cost.
We're not using those funds in that way, but
Exactly, but that's what
to
the
your
encouragement of the
point,
legislation
right,
has,
like,
yeah.
districts that are getting more of that money, they would not be allowed to be able to access the money if they were using outside consultants and support. So part of the hope for the state in cost control is that they are encouraging districts to build their own infrastructure rather than relying on high-cost consultants.
And yeah, just to add to that, Saturday, we will go in depth and we'll show you where that money is going and where it's being offset in the various, object lines and you'll be able to see kind of that shifting of the dollars where it should, balance out and be, like I said, relatively cost neutral, on there. And, to that point, the other piece of that is with the consultation services, when you only need, partial of it, right? It makes more sense to kind of outsource that and kind of consult it, because then you're not taking on additional staffing and the benefits and all the pieces that kind of come with it. It just makes more economic sense to just go to consulting services. But then there becomes this point where, this capacity where once your need gets up to a certain level, it just makes more financial sense to bring the person in-house, but then the advantage of it just also increases the quality of programming. Because once you have like your own person, they're there full-time, they can build relationships with staff, families, students, and so there's a consistency in that. Right now, when we do the consultation services and we bring in OT, we might get, anywhere between, they try to assign just a few within it, but sometimes you might get 3-4 different ones who are kind of coming in. And so, yeah, and just not in the, they're kind of in and they're out. And so you just don't have, like you said, that same quality of care as with your own. So, we've been analyzing that. And we actually started that last year with the first OT position that we did it. And then we're kind of continuing there. And then also with a PT position. So, like I said, our needs have gotten to the point where we believe it makes sense financially and from a quality of programming to bring that in-house.
And that's not to, I would be remiss to say that like the partnerships that we have been wonderful, and we work with extremely competent, high quality vendors. But to Dan's point, like at once upon a time, I think that made sense for Farmington. Where we are at this point in time and that landscape that we see of the ever-changing needs for students, it no longer makes sense for us to move in that direction.
And a little preview to Saturday's presentation,
Yeah, and I would say that the state agrees with you as well.
Yeah, no,
Very much so.
100%.
Yeah, and I know that at some point we're gonna have our legislators come to and this is an area of that there was some significant work that was done in Connecticut around the passing a lot of these, dollars and so forth for special education that encourage you to continue to advocate for, our district and having those programming. I'm just gonna go up the chain here. I don't have too many, but in regards to, if you were going back to Angela's point about the slide that shows the 25%, I just, I think there's an opportunity, doesn't have to be today, but, the level setting around what happens before, those 3 steps about the referral, I can't see from here, so I have my glasses, I don't have eligibility and all that. When you go through it as a parent, you realize the amount of effort it takes from the moment you ask for some kind of a request for you notice that something's going on with your child. You notice that there's something going on. You're getting those ongoing phone calls from the school. Then you're making that request and doing those to determine what's going on, to determine how, is there something that's needed there. All of those steps before that, even the IEP or even that 504 for those kids that are, the students that arrive there, are diagnosed or needing some IOP 504 services, that is a lot of steps. It is a lot of supports from the elementary schools or whatever that school is, this personnel there. And I have witnessed it myself to see the amount of staff that are at those tables to help answer the questions, to review those assessments, to review all of those. It is a lot. And so I just, I think that it's, that whole piece right there needs to be more of an education around what it takes to get to those other levels. And so I just highly encourage in the sense of better understanding what all those steps are. Because
And our desire is to be as responsive as possible, as quickly as possible to support that.
And then, so the other thing that I was going to say, very excited to see, I was at, about the school the behavioral health work there and the partnership we have. Love that, and I'm happy to hear that it's going well, and I'm happy to see that we have this proposal for this pilot at IER for the school-based health centers. That's another space there. I guess some of my questions for future as you're all developing this is that I do know through the state, again, there's been a lot of discussions around school-based health clinics and billable services and all of that. And just, I'd be curious to see how there's any cost savings to our own district around that. And also then I saw the ABA, and there was some legislation that got passed this year around extending the coverage of private and public insurance from 21 to 26 for ABA services. And so just wanting to, how are we also, I know that along with those special ed dollars, I know that the state is looking to has passed some legislation around ensuring increasing the access to billing for billable services like that to offset some of the costs to the district. So just wanting, some of the things that I may have some questions about on Saturday to dig further into, but those are also offset dollars for our district. Thank you. Thank you.
Haley?
Hey, Andrea, I got one.
Matt.
Do you want to let Matt go
No,
first?
no.
Okay, Matt, you can go first.
Thanks, thanks everyone. Thanks for your patience while I'm remote here. Hey, Wendy. Thanks for this presentation. I just want to go back to the consultation line quick. Can you just confirm for me what consultation services you're proposing to reduce? I wasn't sure if it was OT or PT or a combination of those.
So it would be right directly within the line that they're impacting. So right now, a big chunk, historically in Farmington, OT services were all provided by an outside vendor. Last year, we made a shift and we brought aboard one. What we're proposing is bringing aboard our own team. So it would be specifically for the consultation for OT services.
Got it. Okay. So we're just reducing OT consultants.
Yeah, OT consultants, and then in other areas where there are consultation lines, we would look to see where there can be some advantages there to be able to reduce outside consultants and support in different ways.
Got it. So just, I guess, a non-financial part of consultants, can you talk about the experience and skill set of a consultant who maybe works for CCSN or Cheshire Fitness versus someone you bring in-house? And is one more experienced, or would an individual who works for, CCSN be a more highly qualified person than someone who may want to work for a public school system? Just thinking about the qualifications of in-house versus consultation.
The licensure is the same. Certainly CCSN is a very expert group and has been very supportive to the district in developing our programs and overseeing our programs. They're still an active part And we look to them to consult sometimes. And then, you know, in some areas, we have to use consultation specifically if the PPT calls for it, and if student need calls for individual supports and services through a consult agency. This would not impact children that have individual needs that the PPT determined is a need for a specific person or agency to be able to support. Does that make sense?
Yeah, I think what you're saying is if the individual student with the individual IEP needs that sort of skill set from CCSN, for example, that would still continue, I think is what you're saying.
Yes.
Okay. Just the last one, para training and development you touched on. I was curious, I know we talked about professional development days last meeting. How does paraprofessional training occur in the district? Does it occur during professional development days? Does some of these consultants do that? How does that work?
Yep. So as you know, we've been working hard to launch the special education parent team organization. That's where we kind of divided and conquered. They had that. We're providing those opportunities there, but then it is the obligation of the district that during a PPT, not only are we supporting the students' needs, but if there is an area of need where the district can also support the family by providing an individual parent training, then that would be discussed at the PPT, and we would look at that.
Para training.
Oh,
Paraprofessional training. Were you asking about para educator training or parent training?
I was, but that was also good info as well. Yeah, I was thinking about the paraprofessional training.
Oh, yes, and we have done a lot of work on that this year to actually, Dan has been in partnership with me to work with the union to convene a committee. We've actually had very planned and meaningful professional development provided to the paras. To your point, Matt, and questions about CCSN, that is one of the partnerships in the way that we partner with them. They have provided some professional development to our para educators. Farmington Valley Health District also came in and provided we got outstanding reviews for a youth mental health first aid training with our para educators. And then just with our internal staff, we're making sure that we're continuing to develop along those lines. So we've done a lot of work around that this year, and that work is continuing.
And we'll take advantage of like elementary conference days. So when the paras are still working those days, but the teachers and the students are gone, we'll take a couple hour chunk there during those days and provide some training opportunities that are there. So yes, we look for PD days. We look for any of those opportunities where students aren't in the building but the paras are still in the building, and turn those into training and professional development opportunities.
And we're required by law to do 18 hours a year.
Correct.
Correct.
So that takes place on a blend of full half days, the conference days, throughout the school year, just like our certified staff.
No, that's good to hear. Obviously, for the SLC student population, that's sort of a highly skilled area. So it's good to hear about the background on the training. I'm all set. Thank you.
Thank you.
Haley?
Wendy, I just wanted to commend you and Melina on your commitment, dedication, and hard work. When I saw the workload analysis graph, I was pretty floored. Just know, personally, in my professional job, what I do, and just you and one other person support 25% of the district, and that includes teachers, parents, kids. So you guys are superheroes. So yeah, thank you.
More questions on this one? Beth?
So Wendy, the out of district cost control, that's one of those buckets with the legislative updates. I'm sure we've been doing a lot of that anyway, but can you talk about maybe different requirements or how it might change under the new legislation for?
So I am very so there is not a lot of consistency for how private special education facilities bill, right? Some are more expensive than others. Everybody uses a different algorithm or formula, and they're really trying to level the playing field and make it consistent so that you can predict what costs are. Certainly, when we make PPT decisions, we try to find the best support for our students, right? This endeavor by the state to level the playing field really is important for all the students that need that required support, to have a guarantee that they will get it, right? And districts wouldn't be reserved to not give a child what they need because there is no level playing field with the cost. So I am very hopeful with that. We of course take all of that consideration when we're supporting our students.
Thank you.
Anybody else? I had one question, with the reduction of 2 paras, correct? So paras, how do you staff for paras? Is it based on IEP only, that a student is identified as needing a para, or is it?
There are 2 ways. Yeah, there are 2 ways, and we are doing a lot of work in district with making sure that we are making appropriate recommendations for paraeducators, because so good programming, right, wants to make sure that we are providing supports and services that make our children, that will help support our children to be as viably independent as possible. So as they're getting up into those secondary years, they're able to access, because not all of those children are going to have the ability to access an adult agency and continue to be supported. So they need to be independent. Some children, we require one-to-one supports for paraeducators. That's determined through the PPT process. We're working with the district around really collecting data and fine-tuning when that is appropriate, and then putting in goals and objectives to the IEP that foster independence and continually grow. So that's one way paras are recommended. But there are also paraeducators that we have that just provide more of kind of like a continuum support or classroom support within the environment. So looking at that level of staffing, and we've heard this since COVID, right? Like when there's no bus drivers, right? And where are the really, really tenuous places of being able to provide consistent quality staffing, there is a huge turnover in the paraeducator staffing. They're constantly rolling over. So we know through attrition, in between looking at just what's natural attrition and resignations that are submitted to us throughout the year, and then looking at how we're currently supporting students, we're pretty confident that we're able to pull back and support with a certified school psychologist. And some of that work to what Erica had pinpointed before around like putting in those early intervention services and making sure that we're supporting the student early on is the more proactive measure to be able to support and kind of offset confidently that we won't be impacting students with that reduction in staff.
Thank you. Any other questions?
Go
ahead.
I was just thinking about piggybacking on the paraprofessionals. Is there in the district, is there like a differential in jobs for paraprofessionals, like first in district program versus a paraprofessional who might support a student who is included or in like a resource model?
Yeah, there's not in Farmington. Some districts do.
Right.
There is, because there are differences in the levels and degrees of support and the training that's needed, to Matt's point. We have discussed that with the union, and historically it's not something that's been supported in Farmington. So there's not right now.
Thank you.
Any other questions? I just want to make a final comment. Just thank you for all the work you do to support our students with exceptional needs, exceptional students. Yes, there's cost savings, to developing these programs and not sending students out of district. But I think more important is that we're supporting our students and our families to keep them in district where they can be with their peers and their friends and be able to access all the extracurricular activities that are available that they would not be able to do if they were out of district. So thank you again for all your work and also for supporting the faculty and staff so that they can better support our students. Thank you, Ben. All right, next item on the agenda, item 5B, preliminary professional staffing budget 2026-2027.
Thank you. So as a district, our greatest expenditure and also our largest asset is our people. And so Assistant Superintendent Ruzek is going to share with you our recommendations for the 2026-2027 school year. Our team has worked through these recommendations several times, balancing out insights from school leaders, guidance from policy and regulation 6151, retention of staff, all while making responsible recommendations based on current enrollment and student needs.
Great. I'd like to also thank Wendy because I think she's going to have made my job very easy today. And this report is going to be quite short compared to that, just because she's already done a lot of the work of this report this evening. I'm going to turn on this microphone. And so just to Jess's point that he just talked about, the amount of our budget that is in people is a very large percentage of the total budget. So you can see it there in terms of the proposal. We're talking about 80% of the budget. And I would say that the part that I'm talking about today is our certified staff, which is about 75% of this 80%, which in an overall budget is 60% of the entire budget, is what we're talking about in this report today. And so this is our professional staffing report, and I would just say that this is a preliminary staffing report, but it has gone through quite a few steps in order to get to what we're recommending here today. I want to begin with that process just a little bit, just to give you a sense of the full scope of how vetted this list is that we bring to you. So Dan and I, very early on in the budget process, we produce a book. There's about the budget manual like this, and all the principals receive this. And it kind of gives our forecast of the year. What are we talking about in terms of enrollment for next year and all those things. And we meet with each principal probably as early as November. The beginning of November is when this budget starts to become, starts to put together. So we look at the projected enrollments, school programming priorities, and other factors that affect our ability to run the school. And, to Wendy's point, all the different needs that we have that we know of in our population. One of the things we look at the elementary level, of course, are class size projections. And so I have those. I want you to also, at this time, sort of have these pages open. So if you could look, if you have your board packet somewhere, pages 5 and 6 are really the key ones to be looking at if you have questions about how we came to some of the numbers that you'll see on the next slide.
Looks like 34 and 35.
Oh, you have a different numbering.
They're numbered, but in our.
On the
it's 34
online,
and
yeah.
35.
So this report is numbered. So in the report, it's 5 and 6, and in sort of on the screen. You said 35, page 35. Yeah. So that's what's going to make up now. How we staff for our school for next year. We're looking at these kinds of numbers. And so what you can see here, already on the slide here, is that what we're proposing is, it seems like a very large number, minus 7.4 district-wide elementary teachers. So I'll break that down in a minute, but one of the things you should know is that that's really based on policy, and you have the policy in the booklet as well. And so I guess I'll just say quickly here, minus 7.4. Probably wondering how we got to that. So 3 of those I just want to say were not filled. So for those of you who remember, last year we had staff for kindergartens. We didn't need those positions, and so that reduction did not hit our budget this year, but will be hitting the budget next year. So that's not positions that are being cut. There are already positions that don't exist right now in our budget. On top of that, just given the numbers, you can see that we're also able to cut another 4 positions at elementary schools. And that is just to keep us within the policy. And our policy there is class sizes of 19.5. So this, what we're proposing, gets us to about that number across the district. But it certainly doesn't mean that every single class is going to be 19.5 or thereabouts. It means that they're going to have some classes that are small on the smaller side, some classes that are on the higher side, and in fact, some classes that we think are kind of teetering on almost too large, and we consider those to be hotspots. Where I've highlighted that in the sheet there to say those are sort of watch areas where we would say, we might have to do some moving around of personnel if those were to get to that number or even more. So that's what we're talking about here. But you can see there then, looking at that, how we were able to get to the minus 4 other ones. So it's not up here, that's really in the packet here. But by, counting those up where we're, down positions, you could see that the class sizes are relatively manageable there. And like I said, it keeps us within policy. I would like to add too, that we do still continue, as we did last year, we had 1 non-deployed teacher in our budget. And so that's already in the budget. So in the number that you're seeing, there's 1 additional teacher that we consider non-deployed that would help us address any of these hotspots. So it's not assigned to a school, it's not assigned to any level, but these are sort of, we can watch it over the summer and see which class at which school sort of pops up in population, and we could address so that class could be more in parity with all of the other classes that we have. The other minus 0.4 is actually a cut in, it says elementary teachers, but it's really a point to a library specialist that somebody was getting. In addition, when we had schools that were very large, there was somebody who needed to cover a 1.2. That's no longer necessary. They're able to cover that with a 1.0. That was still in the budget, because again, last time we were doing the budget, we didn't know that we were going to be able to reduce to 20 or fewer sections at each school. So that's an actual cut. And also we had asked last year for a 0.2 world languages for Westwoods that would have alleviated class size pressure there. But it's very hard to fill a 0.2. We were hoping to be able to put that together with something else in the district, and it didn't work out. So we never filled it. So that's not a cut, but it is a cut in our budget because we're reducing that FTE. And FTE, I just want to clarify, is full-time equivalent. So full-time equivalent, each teacher is a 1.0, like their full-time assignment is a 1.0, but we don't always need a 1.0 for every position that we have. Sometimes we need a 0.8 of that position, so that would be a 0.8 FTE. And so when I talk about FTEs or partial FTEs, they're just parts of teachers that we're able to utilize in different ways. So I just want you to know that. So that's really the elementary. So you may have been wondering when you saw this, maybe you previewed it and you said, wow, that's a lot. We really haven't been in a position where we've cut 7.4, 7.4 teachers. Again, 3 of those being not teachers that we currently have, 4 of them being teachers in the district. And then we are asking for a 0.2 FHS business teacher. So that's what we're asking for there. And really, if you look at page, I guess that's 36 in your packet and 6 labeled at the bottom. That will really show you that at all of our other schools, at Westwoods, Irving Robbins, Farmington High School, we actually have, instead of declining enrollment, those are grades that are, going up. They're going to be a little bit larger classes. But really, this ask is just in order to expand our programming there. And so we have a lot of demand for business courses at the high school. And last year, a new requirement for personal finance became a requirement. So many more students are accessing business classes. So that took a cut into our ability to provide electives. And we have some really interesting electives coming to you in a board presentation later on in April, and we'd love to support that department and give them just a little bit more in order to provide really robust programming in the area of business.
And just to clarify on that, as Veronica was mentioning with like the Westwood World Language 0.2, it's hard to find a 0.2. There's already an existing 0.6 at Farmington High School, so the 0.2 would just be in addition to that. So it's not like we need to try to find a 0.2 business teacher if this was approved. We already have an existing 0.6 that has capacity to take on a little bit.
And that's a good clarification after I just mentioned how hard
that's right.
it is to find a 0.2. So
That's why I didn't want
to. It's a really good addition to that. And so, as I said, Wendy did a lot of the work for me here because really on the second page are the same positions that she asked for. Now, you might have noticed she asked for some additional ones in her presentation, but remember, those are in nursing services and nursing and related services is the category. You should see those in the budget. I'm talking about professional staffing. And so I did include, which doesn't usually happen because very rarely are we adding an administrator. I did add an administrator here. Usually you would just see the teacher, like certified positions and teachers. But because it's a certified staff, I did include it here. And so, and you know all the rationale for that. Well, like I said, I don't have to go into the rationale for why that's an important proposal and why that became a priority this year. So you can really see that our priorities are aligned to all the things that Wendy really spoke about. But what it really means for us is an overall new staffing change of minus 4.3. In teachers, minus 5.3, but because I added the administrator here, it's minus 4.3 here that we're asking for next year. It doesn't, when you see it in the budget, I'm just gonna warn you, if you're gonna see it, you're gonna say, it doesn't say minus 4.3, it says a different number, but I want you to know that that just has to do with things come off grants and then things go on grants in different ways, pieces, like down to the 100th point and go on and off of grants. So really what I'm representing here is what's the new ask for next year, new positions, not already existing positions that need to be moved on the budget into different categories, just what are the new positions that have been sort of vetted through this process that we talked about, gone through, the meeting with us back in October, then another one with Superintendent Giannini in actually December and January. And those are the ones that were the ones that survived. Of course, there's many more requests, but because we know we prioritize, these are the only ones that we're bringing in front of the board.
Yeah, just kind of to piggyback, like as Ron's saying, this is really kind of the staffing, the programming piece that'll be. Saturday, we're going to focus on kind of like how it fits into the budget, how it gets programmed. And as we know, there's the operating budget, there's grants and different pieces. And so sometimes there's shifts and movements that are there, which then changes the numbers a little bit. Sometimes a 0.2, 0.3 that goes to a grant or gets switched over back to operating. And so we'll dive into that on Saturday, but that's why it does get a little complicated because there's two levels. There's the actual programming and what we're putting in the budget and then actually how we're paying for it across the budget proposal.
And I would say, so two main takeaways is certainly it does fall within the board's class size policy. That's the first takeaway. And then, of course, supports our students, but also another place to look if you were curious to know more about how does this fit in with the board's class size policy is you can use the class size report that I presented in October. That one would give you more information about, how our, especially, well, all those schools are staffed, but also how the high school is staffed and, what are their class sizes already now? Because whatever it was last year will most likely be pretty similar next year because we're not asking for much more. And there is pretty much the same. This year we have 1,255 students. And next year we are projected to have 1,256 students at the high school. So, since we know that October enrollment report was acceptable and within board policy, then this would also be. Any questions?
Questions?
I've got one. Andrea.
Matt, go ahead.
Thanks. Hey, just a question on the policy, just to make sure I clearly understand it. So the 19.5, is that the floor or the ceiling, right? So we can't go over the 19.5 in terms of student to teacher, but if we were at 18.5 or 17.5, would that be fit into policy?
It's really the minimum. It's put in there in order to be fiscally responsible. So it's really a minimum, and the board policy is very clear that you can see there the actual average with this is a 19.3. But it actually specifies that you can round to the 19.5, and so that's why it could be at the 19.3. And it also specifies it has to be across the district that way. So it's not like, you can notice there that there are some schools that are small, that because they are smaller, they actually then need that extra section. They need, like, instead of 2 sections, need the 3rd section. But other schools then actually have to be larger because they have more students, but can't have as many sections.
Right.
Because of just
Right. So if you kept all the 7 positions, that 19.3 would be lower, right? Because we would have more teachers to students.
Correct. And we would distribute it out over more teachers. And I can tell you that each teacher actually represents 0.3%. So each time you add another teacher, it's another 0.3% that would go down.
Got it. But that wouldn't,
Ratio.
we wouldn't be out of policy. It's just we wouldn't be as close to the policy number. Is that fair to say?
Right.
Yeah, so
Okay.
for example, if we were to add another teacher, like we were going to use that and deploy, the ratio would now go from 19.3
To 19.
to 19 to 1.
Right.
Put in 2 teachers, 18.7 to 1.
Right.
So
Got it. Okay. And just to confirm, the 4 teachers as part of the 7, they're currently employed in the district, and would, I guess, is that 1, yes, and no, and 2, how does that look kind of if this proposal actually passes in terms of, who the communication and how that's evaluated?
You want to see?
So Matt, just so you know, we want to be upfront with our staff because we invest a lot in our people. And as we said on the onset of this, right, they're our greatest asset. So I met with the 4 teachers this past week to make them aware that this would be part of our budget proposal, but also that we are invested in them. And something they don't know, because we're talking generally about first, maybe second year teachers, is how much change takes place between today and June, and how, we see attrition from lots of different factors, and that we will be keeping a close eye on those numbers throughout the coming months, because our hope is that they remain with us. And if we look back historically, you would see that for the most part, when we're thinking about, less than a half dozen teachers, historically, statistically speaking, by the time August rolls around, we're replacing that number of teachers for lots of different reasons, like I said. So it's still a little scary for them, of course, but they understand the process and appreciate that, upfront communication, and that we're going to be keeping them updated throughout the spring.
Got it. Thank you.
Anything else, Matt?
I'm all set. Thank you.
Anybody else have questions? Go ahead, Angela.
Just curious on the class size projections and then the number of sections and the average. So I just found it interesting, and maybe there's a reason behind it. Like at Union School, first grade has 45 students, but you did 3 sections. Second grade would have 46 students, so 1 more student, but you would do 2 sections. Would there be a reason why you would do that?
Yeah, I think that when we have, first of all, remember, this is not a final, so there would be some discretion. So let's say one of those grades didn't get to that number, the principal can make a different decision at that point if we really needed to. That's one. And 2, I do think that when we can, we prioritize K and 1 classes being on the smaller side. When we have to make decisions and prioritize, we generally think, K and 1, if they could be smaller, we try to accomplish that.
So that'd be the same reasoning at East Farm. So like K and second have 66 projected students, but the K sections you would have 4 for a ratio, like an average of 16 kids. But in second you would have 3 sections for an average. Just seeing,
Right.
yeah.
Right, but the one place, and I didn't mark it as a hot spot here, but because you mentioned it, I'll say it. The other one I sort of have in my mind as a place where we'd be really monitoring closely is Noah Wallace in first grade, because it's a 20.7 and it's a first grade class. So in another grade, maybe I wouldn't highlight it, but sort of because it's a first grade, I am think it is on my radar.
So K and 1, okay. And then you mentioned that this proposal is for all current staffing is filled positions. So every position except the kindergarten teachers that you mentioned, which were 3, is every other position filled currently? Or do any of the positions are currently out there as open positions? Do you understand my question? So like you mentioned the kindergarten ones, those are obviously not filled positions because they never were needed. But is every other?
So we never did have to obviously fill the non-deployed. So the non-deployed is
Okay.
not a filled position. I'm trying to think if right now we've had a resignation and we're trying to fill it. So there's positions like that are somebody who resigned, which maybe actually it was in the board report last week. So I know they're working to maybe fill it, but actually maybe at this point it is filled.
Not
So
so
there'll be
much for like the element. I mean, I feel like those teachers are probably filled and those are like great teachers, but like I'm not as familiar with like the high school or IR or Westwoods where there's these subject teachers. So are all those positions, so I'm assuming those are all included in here again, whatever we had, but are those all filled positions currently?
There is one position that is currently unfilled, and that's, we have an IoT, which is a technology position, that's not currently filled.
Okay. But that would be on here again as like,
It's in the budget
it's in
for
the
next
budget
year.
again. Okay. Okay, thank you.
Anybody else? All right, thank you, Veronica. All right, next item on the agenda, item 5C, professional appointments, resignations, and retirements.
So as of the time of the printing of this book, we did not have any. I do think we received one this afternoon, but we'll hold off on that for next Monday. There were no other professional appointments, resignations, or retirements at this time, but our teachers do have a February 1st date. I believe there's some contractual language that speaks to informing us by February 1st, so we'll be seeing what happens the remainder of the
There might be some hot off the presses budget book kind of things, because we've already published and, we've already actually gotten one retirement. So it's a little shifting there. We're gonna try to, for Saturday, give you the most up-to-date information that we have, because it always has a little shift.
We actually have more retirements than that. I think we have 5, maybe 4 or 5 retirements. But we, just at this time of year, because they're coming in, they have that February 1 date, we don't do them separately. We give them to everyone package after that February 1 date. We just say everyone who has retired since really the beginning of the school year that we know for the next year that is retiring. The only time we would give you a retirement before that, if somebody was like retiring mid-year, which could happen, then we would give it to you, but otherwise we wait until the date, that February 1 date before we report retirements.
So in the budget then, is it budgeted, so those retirements are usually tenured people that are on higher steps. is that budgeted for, is this budget include those retired people at their current steps, or does the budget include what we're likely to hire as backfills for those positions?
So currently, we'll use this, 4 out of the 5 retired positions are factored into the budget for 26-27 because one just came in this week after we've already gone to print. We haven't been able to kind of, adjust that. But we'll make like a little,
A step adjustment.
Like kind of like this, the step adjustment. And there's 2. Remember we'll make an adjustment on the salary line, but then we also have to make an adjustment on the retirement contribution line. So there's a little bit of an offset there. We still usually end up with the savings on there. And then once again, we usually have a placeholder for a teacher salary. So usually there is that savings where, let's say, top step is, something over $100,000 that's in there. Usually we put a standard teacher at, I think it's like $75,000, $80,000 is our kind of standard rate. So you'd have that savings. Just like anything else, sometimes you materialize more of those savings. If you get, a first-year teacher out of UConn, you get a little bit bigger. Sometimes if it's like special services or, like an AP physics teacher, which is really hard to find, and you can find somebody and their top step, then sometimes it's neutral. Sometimes it costs you a little bit more. Typically, we usually find savings on the retirement plan.
Thank you.
Any other questions? Next item, 5D, deeper learning update.
So included in your packet this evening are the deeper learning updates from all 7 of our schools. This edition features some information about a mentoring experience that took place between IAR and East Farms EL students, and an author visit to Westwoods, who presented on the extensive amount of research that goes into generating even a fiction text. So I found those to be interesting, but there's more available there from all 7 of our schools. Hopefully you get a chance to take a look.
Next item 6, unfinished business. Item A, budget impact, budget update.
So everyone should have received their 26-27 budget book for Saturday. So we always want to give it to you with some advance notice so you can kind of take a look at it. We'll be ready for Saturday, although I feel like we're kind of covered a lot today that can kind of help set a good foundation for a good conversation that we'll do on Saturday. But like I said, we kind of, we'll walk through that line by line. One of the things, once again, kind of previewing a little bit, but to give you a little primer inside the insert, there should be kind of a list of acronyms of all of the, we are famous in education for having little abbreviations for things, IEP, PPT, FBTA, and all those. So there's a little handy cheat sheet for you that we would encourage you to kind of take a look. So we have that going. Other than that, as far as, kind of this year, nothing, nothing significant to report.
Thank you. Next item 6B, review of the 2026-2027 school year calendar. I need a motion.
I move to approve the 2026-2027 school year calendar as presented for a second reading.
Second.
Okay. So we have a full house here.
Me too.
That I don't think they were here to hear about special services or corrections staffing. Go ahead.
Well, so at our last meeting, we had our first read of 2 versions of the 26-27 calendar. And the board asked me to bring back the version of the 26-27 calendar with the addition of the Eid holiday. And so presented in your packet for your consideration this evening is that calendar. Since that time, in working with Veronica and our teaching and learning team, we did make a few tweaks to some of the ways that the half-day professional learning time falls, especially in September. So if you have the version of the 26-27 calendar from last month, and you have the proposed one here, you'll primarily notice those 4 half days that fall in September. We moved 2 of them from the Thursday and the Friday of that week to the Monday and the Tuesday. And so that way we felt like it just made a little more sense to have that soft start and then, pick up steam as the week moved on. And then again, just looking at the way some of the holidays fell in September, we moved 2 of those half days out of September and into the beginning of October. So overall, it's the same calendar. And again, not that those half PD days are the big news. I think the good news is that we're bringing forward the calendar with the addition of Eid, but just so you know exactly what you're looking at and why it might look slightly different, that is the 26-27 calendar as proposed.
Any questions, comments? Can you just comment on moving the 2 early dismissals to the first day of school versus the last 2 days of the first week?
Sure. So just thinking in terms of coming off of the summer and, kind of that soft start, if you will, where everybody's getting ramped back up and what those first 2 days of the school year look like. The thought is it would make more sense to have those 2 days be half days than the 2 days later on in the week. For lots of different reasons, and it's not a soft start just for our youngest students. We know even at the secondary level, we're changing schedules. Things are getting tweaked in terms of the day. Everybody's finding their locker and their way around the building. And so, again, just thinking about one of the bullet points in our regulations is the way that we prioritize learning time. And it seems to make sense that those first 2 days would be half days versus those Thursday and Friday.
Thank you. Any other questions, comments? Just before we vote on this, I just have a comment. I just want to thank all the public, the students, the families, the allies, everybody who's come forward over the past few months to give public comment. I know it's not easy to do, to come before a board and talk about what's important to you and or just to come up and speak publicly. So again, thank you. We've listened and we're really happy to support adding Eid as a recognized holiday with a school closure. So with that, all those in favor?
Aye.
Opposed?
Aye.
Abstentions? None? Okay, motion passes unanimously.
Thank you.
So, next item, we have review of the 2027-2028 school year calendar for a second reading. I have a motion.
I move to approve the 2027-2028 school year calendar as presented for a second reading.
Second.
Any discussion?
I'll just add in for the record that what you'll see when you look at the 27-28 calendar are those 2 PD days moved to, consistent with the 26-27 calendar. Again, we just feel that it makes sense for us to start with the 2 half days versus to end the week with them. And then you will see the 2 other half days from the beginning of the year back in September. And that's just simply because you'll see just less impact in the way that holidays fall during the 27-28 calendar year. So we felt comfortable returning those to September. We talked about this a little bit, just that as we move forward and continue to look at calendars, it's something that the teaching and learning team is going to be working closely with the building leaders on to consider, those pieces of the calendar like professional learning days that we have a lot of control over, how we might need to move and adjust to ensure that we have a good consistency of instruction in our schools. So you'll see those tweaks again, but other than that, the 27-28 calendar should look pretty similar to what you progressed 2 weeks ago.
Questions, comments? Beth?
I just wanted to recognize your efforts in that regard with the PD days, taking that extra step and meeting with the teaching and learning group and
We got very positive feedback. I think the leadership team felt like these were good shifts, and they recognize and want the same thing we want, which is to look at the month of September and see some consistency in those weeks. So they were happy with the changes, but appreciate the feedback, and we'll certainly make sure they're aware of that too. Thank you.
All those in favor?
Aye.
Aye.
Opposed? Abstentions? Motion carries. All right. Next item, item 7, new business, A, authorized signers of agreement for child nutrition programs. Any motion?
I move to approve Jess Siditi, Superintendent of Farmington Public Schools, and Beth Haber, Finance Manager, to be authorized signers of the agreement for child nutrition programs, ED-099, and to sign claims for reimbursement.
Second?
Discussion?
Yeah, so you're really just approving me as an authorized signer. So, but just so you're aware, that might be when we're putting in claims for free and reduced lunch. There's various grants and programs we can apply for, and you need an authorized signer. That would myself and Beth now. So, thank you.
Any other questions or, okay, all those in favor?
Aye.
Aye.
Abstentions? Okay, motion carries. Item 8, consideration of Assistant Superintendent of Finance and Operations report. A, approval of December 2025 financial statement report. Any motion?
I move to approve the December 2025 financial statement report as presented.
Second?
Discussion.
Yeah, happy to report. We keep, moving along with the budget. Things are looking good. Once again, it's always, comes a time of year where Wendy and I will have ongoing discussions about any type of surprises or different things to kind of absorb. As we know, sometimes that could just be a volatile area. But overall, moving along in a good place. And, I don't like making predictions because, something could always happen from month to month, but overall trending well. And we hope it kind of continues on that pace. But happy to answer any questions.
All those in favor?
Aye.
Aye.
Opposed, abstentions? Okay, motion carries. Last item is item 10, report of board chair. The only thing I have is I'm going to distribute the committee liaison assignments. And I did want to just read them for the record. Right now. So on Personnel and Negotiations Committee, James Ratcliffe will be the chair, and other members will be Erica Nowakowski and Ann O'Malley Kerr. Policy Committee, chair will be Erica Nowakowski, along with Angela Cianci and Beth Kintner. Curriculum Committee, James Ratcliffe will be the chair, along with Matt Domachek.
You're close.
Okay. And Haley Pellegrin, Communications Committee, chair will be Beth Kintner, along with Matt Hupfagner and Ann O'Malley Kerr. Liaisons for CREC will be Erica, FHS Extended Learning Opportunities, Matt Hupfagner. Superintendents, Interscholastic Athletic Advisory Committee will be James. Farmington Public School Foundation, Haley. Health and Wellness, Angela. Cafeteria Advisory, Ann. Town Board of Ed Green Efforts Committee, Matt D. Community Council for Equity and Inclusion, Erica, and FHS Building Committee, Beth. And the Noah Wallace Committee is automatically District 1 board members, which will be myself and Beth. So I know some of you have already attended meetings, curriculum, maybe a couple of the liaison meetings, but going forward, you should be hearing from either the committee chair or one of the administrators with dates. And then the only other thing I have is we have the Board of Ed workshop this Saturday. It starts at 9:00, but I believe there's gonna be like breakfast items
Yes,
before.
breakfast and lunch.
All right, so like 8:30 if you wanna have breakfast?
Yeah, I think we should have it set up by like 8:00, but yes, we'll,
Okay,
There's an agenda in the
yeah,
front.
in the front of the,
Pocket of
the
the-
one you got has the agenda, but yes.
okay. And other than that, I don't have anything else. So motion to adjourn?
I move to adjourn at 8:42.
Second.
Okay, all those in favor?
Aye.
All right, we're adjourned.